Hey YouTube, it's Marita. Welcome to another edition of the Nurse Lounge. And in this edition, we are going to talk about 10 things that I absolutely hate about being a nurse. So if you want to see what things I hate, stay tuned. All right, per usual, I have my note cards to basically guide me so that I can stay on track and to make sure that I am saying what I really want to say. So I tend to get sidetracked quite a bit, easily distracted. It's part of my OCD. Not OCD. That's just part of me. I don't have attention deficit. So I do have OCD though. But anyway, let's get back on track. So 10 things that I hate about being a nurse. And these things are things that are just true for me in terms of nursing. This is in no way saying that I don't want to be a nurse anymore. I'm not saying that, but there's no one I know who has a job that they love everything about it. So we're going to, kind of talk about some of the things that I do not like about being a nurse. And it's 10 things that I have. And there's more. Believe me, there's more. But I narrowed it down to 10. So number one is the politics of being a nurse, especially in the hospital setting. So the politics of being a nurse basically, involves your management. It involves just your staff. Keep in mind that nursing is primarily a female-dominated profession. So therefore, there's a lot of cattiness. There's a lot of cliques that I can't stand. There is a lot of competition, believe it or not. People always want to one-up you and try to be better than you and things like that. Sometimes you don't have people who are willing to help you when you need help. I can't stand that when the right hand don't know what the left hand is doing, so to speak. So it's always a CNO or someone in upper management who wants to roll out a new policy, who either is so far removed from nursing in terms of bedside nursing that they have no idea will this work or not. We put it into practice. It did not work like we knew it wasn't going to work. And we're back to the drawing board. It's just so much of logistics of being not a new nurse, but a nurse in general. If you're new, that's even worse because you don't even know what normal is because you haven't been there long enough. But when it comes to nursing in general, I just cannot stand some of the politics that goes on behind it, the bickering, just the bickering and all those things that nurses typically do. Not always. If you find a good batch of nurses, then that's great. But for the most part, there are situations in which you're kind of like, you know what? I see somebody coming down the hallway, I go the other way. Or if I see that we have self-scheduling, so if I see that they're working that day, I will not schedule myself to work because I don't want to deal with the drama that comes from working with them. All right, number two, nurses eating their young or nurse bullying. That is still something that goes on today. We called it nurses eating their young, but today it's more so nurse bullying. And it's to the point that nurses are completing suicide as a result. So that's very, very serious. And why are we doing that? Why are we still, bullying or eating our young, so to speak? And it doesn't mean literally eating our young. It can be more so, well, not literally eating anybody, but it doesn't mean you have to be young. It means you could be new, though. So I could be a nurse for 15 years, but I go over to a new facility, then I'm going to get the same kind of like hazing treatment that somebody would get if they were a new grad. So it doesn't necessarily mean eating the newest nurse, the new grad. It's the new person. If you don't fit in the clique, then, you're kind of an outcast or you're different or whatever. I'm considered to be an outcast because I'm getting an advanced degree, and people who have their associate degrees, who I've worked with for the past, say, 10 years, who still have their associate degrees, and that's all they want, they've kind of pushed me out, so to speak. So, and it is what it is. I'm okay with that. But nurse bullying, which I'm going to do a video specifically on that, probably in the next month or so, because I find that to be a big issue still, and I find that people are going home having issues with not liking their job or not thinking that nursing is for them because of these situations. So again, nurse bullying is real. Nurses eating their young is real. I will talk about how to combat that and deal with that and what to look for and basically almost the depression that goes along with that. But I can't stand that. It's really sad that we still have to deal with those things like that. But that is something I truly hate about nursing, is that we do that. And I'm sure they've been doing that since the inception of nursing, and since Nightingale era. But we're still doing that today in 2019. And again, people are completing suicide as a result. It's gotten that serious. So we got to do better with that. Number 3, I hate about nursing that it's become more customer service oriented. What I mean by that is back when I first finished nursing school, it was truly healthcare was a primary focus. Well, it could have been transitioning back then, but it's just changed a lot. Healthcare has been a focus, but now it's more so about the business aspect. And when I say business, I mean customer service business. I'm not saying the monetary in terms of like, people paying their bills, but it's very much driven or done like how you do when you go to a 5-star restaurant. You are going to get the best ambiance, the best experience. They're going to provide you, great dining, and they're going to give you, the waitress or waiter is going to give you great service, hopefully. And you're paying for that service. You're paying for good food and things like that. Well, healthcare has become that very same thing where it's mimicking that 5-star service that we're supposed to give now. And the problem with that is, it's not a problem per se, but the problem with that is it is trumping the true healthcare aspect. So like, for instance, it may be a situation where our policy is for us to start where a policy example where you have to be, let me think of a good one. Here's one, because it just happened. So at our facility, we have a discharge class that our patients have to attend, okay? And it's a long story, so I'm going to try to shorten it. But our patients have to attend a discharge class in order to go home, okay? I work on OB real quick. And basically, the class entails your discharge information. Once you get your discharge information, then we print your paperwork up, you sign it, and then you can go home. Of course, once you have your orders that you can go, and baby can go. But what's been happening is, for patient satisfaction, some of the nurses have been doing their discharge teaching inside the patient's room. Problem with that is because we don't do couplet care. We have a nursery nurse and we have a postpartum nurse. The reason why we went to this class is because the postpartum nurse and the nursery nurse could not collaborate their time in order to do their discharge teaching. Because for me personally, you being discharged is not a priority over me getting a fresh new admission. And as a patient, if you don't understand that, then it is what it is. But when it comes to my ABCs and safety, airway, breathing, circulation, and safety, if you are going home, those things should be good to go for you. Whereas my first patient who just delivered, I don't know if that's good to go for her. So therefore, I need to go see her first. She's a priority over you getting discharged. And so as a result of this customer service element, we decided to develop a class in which you would go to get all that teaching done, so you're not waiting on any nurse to do it. And then you can sign your paperwork and you can leave, because patients were complaining about the fact that we take so long on discharge, which, like I said, it is what it is. Because that means while I'm doing your discharge teaching, I'm also not seeing my other 5 patients that I have. And so that's kind of the reality of that. But with this class, you go to the class. While you're going to the class, I print your paperwork up. When you come back from the class, then I have you sign it, because then I'm done. And you had your class. You're not waiting on me. It's a smooth transition. Well, we had a situation where a nursery nurse wanted to do a patient a favor by doing her class in her room. But that also meant that I was going to have to stop what I'm doing to do the other part of her class in her room, which that defeats the purpose of the class to begin with. So I was going to actually do her discharge teaching myself instead of her going to the class, or that's what the nursery nurse was going to do, meaning I would have to do the same thing. Well, then she comes to me and I said, well, I don't have time to do that right now. And she said, well, she's really ready to go. Then she needs to go to the class. The class is happening right now. She can go to the class. Well, she's had so many babies before. She doesn't really need the class. It's a formality of being discharged. She needs to go to the class. Anyway, it ended up that she said, well, because of patient satisfaction, we have to do what the patient wants us to do. Those words right there is what really did it for me, because I'm like, no, that's not what this is about. I have a new admission I have to go see. I cannot do a discharge class right now. It's not for, so if you want to do both my section and your section, have at it. Go ahead and talk about postpartum and nursery care. But I can't stop what I'm doing right now for patient satisfaction when I have a new admission coming in right this minute. And so she was very upset with me because I didn't, stop what I was doing and basically do this discharge class. And so I don't remember what ended up happening. I think I had another nurse to go do it, but that's kind of my point. It's basically, it's changed where we have to do that now. Or another example is we're required to do every 1 hour rounding during the day. Well, if a patient says, no, I don't want it, the 1 hour rounding, that I want to sleep, there's not a policy on that. But your management will probably tell you, well, go ahead and let them rest. But if something happens to that patient while you didn't do your rounding, you're still liable for it. You're liable for it. So that's the issue that I have with nursing, whereas they want us to be customer service oriented, but at the same time, they don't want to take on the responsibility if something happens while we trying to give them their every need or whatever they want to do. These people want to, have back rubs and things like that. They're wanting to, we want you to pour their water for them. And in some floors, you have to do that. I'm not talking about I'm talking about my floor. My floor is the OB floor where everybody can do for themselves. Or they want you to, be in their room. The patients want you to be in their room and change their pads for them every so many hours. Absolutely not. If you are a situation where you have to be changed every so many hours because you can't do it for yourself, then that's when we come in and do it. But I definitely believe in you, resuming your own care once you have your baby, when you're about to go home today. Okay, you're going home today. You should be changing your own pads at that point in time. So anyway, it's just that customer service orientation that we have where patients are beginning to treat us nurses as if we are maids or servants and not that we are the ones who are managing their care. And that's what registered nurses do, or nurses do. We manage patients' care. They don't manage themselves. We manage their care, because if they manage themselves, they can manage it at home, which is what they do when they go home. So while we're in the hospital setting, RNs, LPNs, we manage patients' care. So therefore, we have to be the ones who kind of set the boundaries, set the tone, things like that. And so this customer service orientation that we have, or oriented environment that we have, is being kind of, it's a tactic to basically get more money, the same way you would have at a restaurant. We want more money. We want your services. We want you to tell somebody else about our service. So therefore, we want to do it that way. That's great in the business aspect, but it's very hard on that nurse. It's very hard on the nurse when they say, okay, well, I wanted you to come in here, 10 minutes ago to bring me my Sprite. Well, I'm sorry, I was actually taking care of another patient because she was hemorrhaging. So not that I would say it in that manner, but that's the reality. I'm taking care of a patient who's hemorrhaging, but yet, you wanted a Sprite. I couldn't get the Sprite right then. That's the mentality that our patients have in general. Now, this may be going on everywhere, but definitely in our floor that we have, that they're acting like that. All right, number 4. I kind of just mentioned this in number 3. Increased demands on being a nurse. So I hate the fact that we have increased demands. We are seeing our patients less and less and less and doing everything else other than what nurses do. So I have to call DCS and file reports with them in case if I have a mom who has a drug, she comes up positive, baby comes up positive for drugs. I have to call DCS for that. I have to handle case management situations. We do have a case manager, but we have to kind of be the liaison and help that situation out. We have to, chart, obviously. It takes longer to chart than it does to see your patient 9 times out of 10. We have to also do a lot of cleaning and things when it comes to our unit. So somebody's in charge of wiping down the microwave. Somebody's in charge of wiping the refrigerator out. Somebody's in charge of, making sure things are restocked and things like that. Somebody else, you're in charge of now adding, we're getting added all these different tasks to our jobs, and they have to be done within a timely manner within your shift. And you still have to see your patients, and you still have to medicate them, and you still have to do their vital signs and things like that. So it's just very, very difficult when you have increased demands that you have to do when it comes to being a nurse. It's not just going to see your patient, do an assessment, document your assessment, and go sit down somewhere. It is so much more than that. Plus, you do your patient education, your teaching. Now, anything that's necessary in the nurse role, I don't have an issue with. I don't have an issue with doing my education, with my teaching, with my vital signs, in my floor, we don't have any techs. So we do all our vital signs, do our eyes and O's, we get our patients up. We do everything ourselves, plus what the nurse does. We make our own beds, we bathe people if need be. We do it all. But on other floors, they have techs. We don't have that luxury. So therefore, we do everything. So the increased demands of having to do even more, it's just very difficult. It's just very difficult. So I'm not really a fan of, having to do more and more work for definitely no more money that I'm getting. And that's another reason why people are moving out of the bedside, because of the fact, away from bedside nursing, because of the fact that you're placing more demands on us and you're putting us at more risk in terms of liability. And you are not giving us any more pay. You're not protecting us in any kind of way. You're wanting to go down to a skeleton crew. So you're changing our ratios in the negative, meaning that you are wanting us to take on more patients, but yet we don't have more staff. You're wanting us to do rounding more often than we're already doing. Now you want us to do bedside reporting every shift, which is not an issue. But then you also want us to be out by 7:08. But when we have 24 patients on the floor, we can't be out by 7:08 because we have to give reports to everybody and do bedside reporting on every patient. That takes a lot of time when you have 4 nurses for that. And just so you know, our ratios are 1-6. So we don't get a third nurse until we always staff with 2 nurses, but we don't get a third nurse till we get 13 patients. So at 13 patients, we get a third nurse. It doesn't make a difference what the acuity is. And acuity, in case you all don't know, is basically the degree of intervention that they're going to need. So if you are a fresh surgery patient, your acuity is higher than someone who has had surgery 3 days ago, because there's more work to do, more interventions to do, things like that. So we're having all these demands placed on us, but yet we don't have any extra help. So it's very, very difficult. Number 5, I would say lack of respect from fellow doctors or from fellow nurses and doctors is another thing that I hate. Sometimes, depending on how this doctor kind of time period he or she grew up in, or when he or she became a doctor, they have a blatant disrespect for nurses anyway. Like, you're here to do my, to take care of my patients and this, that, and the other. It's not a partnership where I do my job, you do your job, and we meet in the middle. Which is how it should be. Excuse me. But what it is basically they have this way of being condescending. They're more educated than you are. They're this or that. You don't know anything, and on and on and on. And you get that same disrespect from nurses as well. And unfortunately, when the patients see doctors acting like that, that's when patients think that they can also act that way, and they treat you any kind of way. And it's difficult. It's difficult when you have nurses who are patients, doctors and nurses, who all treat you as if you are, you are a maid, you are a servant, you are beneath us. The patients feel like that we're beneath them. And I'm like, I'm not beneath anyone. If anything, it's just like the people who make your food. Don't make them mad. Don't make the people who make your food mad. Same thing with nurses. Don't make your nurse mad. Now, not that he or she would do anything to hurt you, as they should not. But the thing is, that's the last person you want to make mad, is the person who is, who has your pain medication when you definitely need it. You don't want to make anyone mad, but at the same time, when you're being disrespected, it's hard not to be mad. So I don't deal well with disrespect from physicians, from patients, or other nurses. And if they're willing to dish it, they're going to be ready to take it, because I don't tolerate that. I mean, you're going to treat me like I'm a person. If I don't know how to do something, I'm going to tell you I don't know how to do something. If it's something I don't know, I'm going to find out for you, but you're not going to disrespect me in the process. So again, that's number 5, lack of respect from fellow nurses and doctors and patients alike. Number 6, I hate when nurses don't follow the rules. So therefore it makes you look bad as the next nurse coming on. So prime example to this is, I work on an OB unit, and you can't go smoke. Okay, it's a no smoking facility. Well, it may be the nurse before me who would say something like, "Oh yeah, you can go ahead and smoke, and come back and get your pain medication and things like that." I don't allow it. You're not gonna go take no narcotics. If you're gonna go off the floor to smoke, because we can't restrain you, so therefore I can't make you stay here. I can't make you stay here. But if you can't stay on the unit, you can't have narcotic pain medication from me. And that's a nursing judgment. That's not a nursing policy. So I will not give you narcotics to leave the floor to go smoke. I'm just not going to do it, because I'm still responsible for you when you're out there by that flagpole smoking. But I can't see what you're doing. So it makes me look bad when, you said, "Yeah, go ahead and smoke. I don't care what you do, this, that, and the other." And then I turn around and say, "No, I'm not going to do that." Or another example is when it is given pain medication, the patient may say, "Hey, just put my pain pill on my bedside table and leave it there. I'll take it when I'm ready." We have had nurses who do that, and I won't do that. I'm like, "No, I need to see that you take this medication, because I'm documenting in the computer that you're taking it right now. And this is gonna, I need to know that you took it, so you need to take your medication." Well, that last nurse, that's what you get. That last nurse I had, she would just sit on the table. "I'm sorry, I can't do that." And so now I'm every name in the book, because I won't follow suit with what that last nurse did. I cannot stand that. And one other thing I can't stand that nurses do is they will tell the next shift, they'll tell the patient on the next shift what the next nurse is going to do. Don't do that either. I can't stand that. So we have C-sections that get up about 12 hours post-delivery. And because they get up 12 hours post-delivery around there, I know about when to get my patient up. Well, we had a situation where she wasn't scheduled to get up till around 11 o'clock in the morning, 12 o'clock, somewhere around there. The nurse on the previous shift had told her that we were going to get her up about 8:30 in the morning. Well, 8:30 is right after shift change, and that's when I'm passing my morning meds and things like that. It wasn't happening. So when she found out that I was not going to do that, she was very upset with me. Well, that last nurse, I said, well, I'm sorry, but she should have never told you what I was going to do when she didn't know what my schedule was. I cannot stand that. Do not do that to nurses. Do not tell what somebody else is going to do, because you don't know how their schedule is going to be. You don't know what emergencies may pop up between the time that you told them that and when it actually is scheduled to happen. So I did get her up earlier than 12, but it wasn't at 8:30 in the morning. She was upset with me. She wasn't upset with the last nurse. She was upset because I couldn't do it. I was like, I'm sorry, but she does not plan my day. I plan my day. So why do we do that? I don't know. I know we try to do that to say we're providing good care, but it's not great care when the person you're talking about who's going to do something was not part of the team to begin with. So I can't stand when people do that. So you make us look like a total B when we are going to follow policies, we're going to follow rules, we're going to do certain things. And if you don't follow them because you want to be the nice nurse and that's not part of the protocol, then you are setting the rest of us up for failure. Nurses are notorious for doing that because you want to have the Daisy Award, because you want to have this, that, and the other, but you want to make the rest of us look like total Bs because of the fact that we are actually following policy and you're not. So I can't stand that. If you want your Daisy Award, great, get it. But make sure you're following policy. If you're not following policy, make sure you tell the patient, I'm just doing this for you, but the next nurse may not do this for you because it is not required for them to do this for you. We've had, nurses who they're in there giving back rubs every hour. They're doing massaging their feet every hour. That I don't have time to do that. And that's not what I'm required to do. But of course, when the next nurse came on, me, and then the next one who came on after me, she was just like, well, y'all didn't, you all didn't massage my feet and this, that, and the other. We were not required to, nor did we have time. So those are the types of things that I'm talking about when we set the next nurse up for failure and it makes us look bad. It's because someone hasn't followed the rules or policies that we have in place, and then they make us look bad because of the fact that we are going to adhere to those policies. All right, moving on. Number 7, when patients lie on you to the doctor. I cannot stand that. I can't stand that. So I had a patient who, I wouldn't say it was a lie per se, because what was said was, I took her temperature was 99.9, I think. And our policy is to call the doctor when it's 100.4. So I had basically told her, so we have a very low grade fever. We're just going to watch it, but right now I'm not going to do anything about it. So the doctor comes in to make his rounds, and he comes out and saying the patient states she has a fever, and why come I wasn't notified? That's what the doctor said. I said, because it was 99.9. If you want me to not notify you for 99.9, I will next time, but your actual order says 100.4. Well, that's right, but she said she had a fever. I said 99.9 is a very low grade fever. I said, but I never said she had a fever, and I explained that to her already. Or different patient, but the patient was like, I asked that morning, were you in pain? And she said no. Or she said, yes, I'm in pain, but I don't want anything right now. And I documented just what she said. That patient, was in pain. She rated it a 3 out of 10, put where it was, and she was cramping, and that she denied the need for medication at this time. So now it's shift change. It was 15 minutes later, shift change. And of course she can change her mind. That's not the issue, that she changed her mind, because sometimes she's like, you know what, I think I will take that medication. That's not the issue. The issue is she lied and said that I never offered it to her to begin with. And so then I went back and showed the documentation. I went back in with the doctor. I said, oh, okay, you said I never ever mentioned the medication to you, never offered it to you. Well, when I came in the room with the doctor, she changed her story. Oh yeah, I think you did. Yeah, because you were sitting there about to lie. And so then when they start lying on you, then the doctor naturally defends the patient. It's like, okay, well, you need to make sure you're taking care of the patients because I don't want them to be in pain. Well, I am taking care of the patient, and she didn't want any medication for a pain of a 3 at that point in time, and it's been documented accordingly. That's when I learned that you document things like that and document exactly how it happens, because in 10 minutes, they will change your mind. And it's okay that they change your mind. Like I said, the issue is they don't need to lie on me about it. Number 8, things I hate about nursing, that people say that we're just a nurse. I have a whole video on that, so I won't really go into detail about that, but I am not just a nurse, because a nurse manages your care. A nurse is the one who calls the doctor when you are going down. Doctors don't find that, nurses do. Okay, doctors are only ones there who come and say, oh, we need to go to surgery, we need to do this, we need to do that. Nurse is the one who knows what's going on with you because they've been there the entire shift with you. So it's the nurse who's taking care of you. You never want to tell, a nurse that she's just a nurse or he's just a nurse, because I'm telling you, he or she is your lifeline to stay on this side of the earth, of the ground, okay? Because if you have a bad nurse, let me tell you, you're going to find yourself 6 feet under. And nobody wants that. So therefore, she can't be or he can't be just a nurse when he's the one or she's the one taking care of you, especially if he or she is very knowledgeable about what's going on with you and why you're getting sicker or whatever's going on with you. Nurses a lot of times pick that up for you. They're the ones who are there who are taking care of you, not the physicians. So, that's why I say you need to learn people need to learn to respect nurses, because we are it majority of the time. Number 9, another thing I hate about nursing, or this new generation of nursing, because I do say it's new generation because things are changing from when I went to school, that many of the new grads don't take nursing seriously. So if you are a new nurse, or you're thinking about going into nursing, so you're pre-nursing, future nurse, I cannot stand that some of you, not all of you, do not take nursing seriously. I don't know what you think you're getting into, but if you do not, it kind of piggybacks off of what I just said. If you do not know how to assess your patient, if you do not know how to critically think, you are going to kill someone. It's just that simple. You're going to kill someone. You have to know what to do in every situation. And if you don't, you need to get help. You're not going to be expected to know that when you first come out of school. But I've met so many students who have told me, oh, well, I'll get that when I get out. Get out of where? Because they don't have time to teach you all of everything in nursing school, or when you get out. And believe it or not, 15 years in, I'm still learning things new today. I'm learning how to do things new today. So you don't learn everything in nursing school. You need to take this job seriously. You could kill someone by not knowing, or only want to know what's going to be on the test. No, you need to know everything. Learn it for the test, but you need to know everything. What you're learning today is about saving lives. It's not about, just passing the boards or passing a school test. You're learning what you need to learn to save someone's life. Would you want you as a nurse? Think about that. If you don't know how to do nothing, would you want you as a nurse? Most of you would say no, because most of you don't even know, what your ABCs are when it comes to nursing. And not most of you, some of you don't, because I've met some of you, okay? Because I've had some students who don't know what the ABCs are in nursing when they're about to graduate soon. I've met so many people who don't know how to pass one medication by themselves. Part of that is due to the nursing program that you're in. Part of that's due to the clinical sites that you have. And some of it's due to you don't want to learn how to be a nurse. So I can't give you, say that it's all your fault, because it's not. A lot of it falls on different confounding variables, but confounding variables. But for the most part, nurses or new nurses are not taking nursing seriously. They don't know what they're getting themselves into. They just think it's something to do where you're going to make some decent money, and that somebody else is going to take care of everything. Well, all you got to go take out a catheter when need be, put a catheter in when need be, go start an IV. We do so much more than that. So much more than that. So definitely learn how to be a nurse. And the last but not least is I hate the hours of the hospital. Meaning most hospitals are now doing 12-hour shifts. So you're working either from 7A to 7P, 7P to 7A, 6:30, 6:30, whatever happens to be, you're working 12-hour shifts. I'm getting too old for that. Half of my day is literally gone in a hospital. And I can't stand it. I really wish we had more jobs that were 8-hour shifts. But we don't. You're going to work 12 hours, and it's kind of hard in terms of, family, having small children. I will say that nursing is not a family-friendly profession at all, especially in the hospital. It is not a family-friendly profession. It is not children-friendly. And you're missing out on a lot of things when it comes to your children's growing up because of the fact that you're working 12-hour shifts and because of our schedules coming out over 2 months in advance sometimes. That when the schedules come out so far in advance, then when something pops up at school that's going on with your child, unless you find somebody to replace you for your shift, you can't attend. And so you miss out on a lot when that happens. Or if you work night shift, you miss out on a lot anyway because you have to sleep the next day. So anyway, these are my top 10 things that I absolutely hate about nursing. I'm in no way trying to bash nursing as a whole because I'm still a registered nurse, been here for 15 years. I don't really see myself in the near future getting into any other type of profession outside of nursing. But these are just some insights to the people who are either new to nursing, thinking about going into nursing, or maybe you are a nurse, but you're working in a different field of nursing. You want to know just kind of what somebody else feels when it comes to nursing. I think a lot of those things that I just mentioned are nursing. Every nurse has a few of those things that they can't stand. And if you love those things, then great. But majority of those things, I know other nurses feel the exact same way, and maybe worse. And they may have other things that they would like to add as well. So anyway, if you are new to my channel, thank you so much for watching this video in its entirety. It is a 30-minute video, a little over 30 minutes. But I do want to share with you, just my insight and thoughts and educate and inspire on this channel when it comes to nursing. If you happen to like things other than nursing, such as plus size fashion, makeup, beauty, lifestyle, if you want to follow me on my doctoral journey, definitely subscribe to this channel. I think you will be enlightened by some of it, educated by some of it, even maybe upset with some of it, but it is what it is. I'm okay with that. Definitely hit the notification bell so you know the next time that I upload. If you look at the very top in the YouTube banner, you will see 2 Instagram icons. One is for my lifestyle, plus size fashion, makeup, beauty page on IG. Follow me there for that. The other one, if you hover it over, it says Instagram 2. It is for my Melanin RN _MPN page, which is my nursing page. Again, meant to inspire and to educate. So definitely follow me on my social media platforms. I truly will appreciate it. And until the next time, you all take care. When you're standing here beside me.